Hello, everybody, and welcome to this online MSc Global Mental Health webinar Q&A session. So my name is Julie Langan-Martin, and I'm Professor of Psychiatry in the School of Health and Wellbeing at the University of Glasgow. So what I was going to do in this session was talk a little bit about the university and the School of Health and Wellbeing, where our programme sits. I'll talk a little bit about the benefits of the online Global Mental Health programme, a bit about its curriculum and content. We'll touch on some of the key features of the online learning environment that we use. Everybody, all our attendees are on mute, but you're very welcome to ask questions during the session, during the Q&A feature, and I will do my very best to answer any of these questions just now. Anything we can't answer, we can send you information on as well. And a recording of the webinar will also be sent to you after the session. So my name's Julie Langan-Martin. I'm, as I said, Professor of Psychiatry in the School of Health and Wellbeing. I'm also Director of Education within the school as well, and I lead the online MSc in Global Mental Health. So my primary research interests are in global mental health and in the interface between major mental illness, and by that I mean schizophrenia and bipolar disorder, and physical health comorbidities. I also have an interest in ECT, and I work clinically 1 day a week as a consultant psychiatrist in liaison services in NHS Ayrshire and Arran. I'm a fellow of the Royal College of Physicians and Surgeons of Glasgow and a member of the Royal College of Psychiatrists as well. So the University of Glasgow is old. It's an institute that's been established in 1451. And I think what's really important to recognise is that 81% of our research is judged to be internationally excellent, and this was in the REF. And we're very keen and eager to ensure that our teaching is research led. And indeed, we were ranked first in the Russell Group for teaching in the NSS, which is the National Student Survey, back in 2018. And we have 7 Nobel laureates that are connected to the university, and we have been ranked in the top 100 of the world's universities again in 2019. So again, just thinking about the history of the university, which was established back in 1451, we've had a number of really innovative and globally famous alumni from the University of Glasgow, people like Adam Smith, for example, Lord Kelvin, who you may know because of the absolute temperature scale, so this thing called absolute zero. Joseph Lister, back in 1867, introduced antiseptics into surgery. John McIntyre, for example, again in 1896, opened the world's first X-ray department. And we've had, as is shown on this kind of timeline, various Nobel Prize winners and lots of famous alumni from the University of Glasgow. Thinking about the School of Health and Wellbeing, which sits in the College of Medical, Veterinary and Life Sciences, or the College of MVLS, our mission within our school is to prevent disease, improve health and wellbeing, and reduce inequalities. And we want to do this locally, nationally, and globally. We're very proud that we have an Athena Swan Gold Award, which was renewed in 2023, really showing our commitment to equality and diversity. We have lots of really good connections to the Scottish and UK governments, as well as the National Health Service or the NHS, local authorities, as well as voluntary and private sectors. And the institute or the school has been at the forefront of some of the major public health interventions that we see in Scotland. So, for example, some of our really kind of notable research has involved assessing the minimum unit alcohol pricing policy that was introduced in Scotland several years ago. Colleagues within the school as well have been involved in evaluating the impact of the smoking ban on health. And more recently, there was a piece of work done thinking about footballers and heading balls. And there's been a change in policy within the Scottish Football Authority, or the SFA, to really ensure that children aren't really heading balls anymore, because the research from our school suggested that this can have really quite negative long-term impacts on brain health. So it's really nice to see the research that's happening in the school changing policy, but also being included within our teaching as well within the school. So why global mental health? Or why the Global Mental Health Masters Programme at the University of Glasgow? So you will benefit from leading research, cutting-edge topics, and first-hand insights via international experts. We have speakers with lived experience of mental illness, and we have lots of interdisciplinary lecturers who contribute to our courses. We take a really central and important focus on the impact of social and cultural factors on how we treat and how we diagnose mental illness globally. We take a very significant think about the social determinants of health. And because we are in a city which has got lots of problems with health inequalities as well, we feel that we are really well placed to be thinking about the social determinants of health within our context. We also want to reduce the global mental health treatment gap, and being able to do this is high on the agenda of the United Nations and indeed the WHO. And we do collaborate, as I mentioned previously, with lots of different institutions, the NHS and third sector organisations. So we do think that this programme is unique given where we're seated within the university. In terms of the learning outcomes, so we're wanting graduates to be able to think about how you can address global inequalities in mental health service provision. We want to be encouraging our graduates to think critically about the challenges associated with globalising ideas around mental illness. And we also encourage graduates to think really critically about our links with colonialism. And we're encouraging and we're trying to think about how we can continue to improve and decolonise our curriculum. We want students to be able to develop and implement policies to reduce the burden of mental illness globally and to be able to integrate initiatives into wider international development aims. And we're hoping that our future graduates will be able to forge their own mental health policies, strategies, and services in the country or the place that they're working. In terms of the actual curriculum and the structure of the course, for the master's programme, you have 3 core courses. So these are listed here: themes in global mental health, research methods in health and well-being, and mental health and disability, international law and policy. And these courses are worth 20 credits each. And then we have the dissertation course as well, which is worth 60 credits. In general, people study one course at a time, one course every semester, and we have 3 semesters running in September, one in January, and then one in April time. In addition to the core courses, there are a range of optional courses that are listed here, and you're able to choose which optional courses you would like to do that are aligned to maybe areas that you're interested in. So, for example, some of our online students are very interested in thinking about mental health promotion, so they will choose courses like mental health promotion across the lifespan, for example, and the cultural, social, and biological determinants of mental health course. Other students are maybe coming from a more data science point of view or coming with an interest in health economics, and they might choose courses like health economics for HTA or data science, for example, or indeed HTA policy and principles. So we've got lots of different courses that might be aligned to your kind of area of interest. Other optional courses include things like globalization and public health, qualitative research methods for public health, again, health promotion, principles and practice, an introduction to epidemiology and stats. So lots of different courses that you might want to take as an option. And again, for the full master's programme, students are required to take 3 additional optional courses, as well as their 3 core courses and then their dissertation, and that makes up the 180 credits that are required for an MSc. In terms of career opportunities, so we're really hoping that we aspire people who want to lead and improve access to international mental health services globally. Some of our graduates have gone on to have careers in national mental health policy and planning. Some graduates have gone on to work in mental health services research, for example. Others have gone on to take advisory and advocacy roles in governance, international agencies, and non-governmental organisations. So we actually had a session just yesterday where we were in contact with several of our alumni from the Global Mental Health Masters programme. One person who joined us yesterday afternoon is based in Jakarta, and she's working as a lecturer, and she's involved in some of the disaster responses and delivers a lot of psychological first aid. We had somebody else join us from Kenya, where he works within mental health services in Kenya. So there's lots of varied career opportunities and options for our graduates. And that just is a couple of examples just from yesterday from one of our sessions. I just wanted to mention Vitaly Klimachuk, who was our world-changing alumni, so award winner for 2024. So every year the university has a world-changing alumni award prize, and Vitaly is the first winner from an online distance learning program, and he is a Global Mental Health alumni. He completed the postgraduate diploma in Global Mental Health a couple of years ago, and then it was lovely for him to come over to Glasgow earlier this year, where he was awarded with this cup. And it was lovely to meet him finally in person, having only previously engaged with him online before then. So our entry requirements are listed on our website, but we are looking for applicants to have at least a 2-1 honours degree or equivalent in a relevant subject. So we take graduates from diverse backgrounds, so psychology, medicine, nursing, occupational therapy, law, public health policy, something that is potentially aligned to global mental health. Some people might not have an honours degree, they might have a registered healthcare professional qualification, so things like a nursing degree will also be considered. A background in mental health is desirable, but it's not essential because we recognise that some, with global mental health and mental health becoming much more important in the agenda, we recognise that we should be open to a wide variety of graduates. International applicants must have an IELTS score of 6.5 with no less than 6.0 in any band. In terms of the online environment, a lot of our materials are asynchronous, so this means that they can be looked at in your own time. We've done a lot of work to ensure that our learning materials are interactive, and we have Microsoft Teams space embedded within the learning materials to try and encourage interactive real-time discussion amongst peers within classes. We have interactive videos, podcasts that you might listen to. We've journal articles, electronic books, and other web resources all integrated within the learning materials. You're also able to download the content so you can have a look at it offline when it's more convenient to yourself. And we ensure that our learning materials are all accessible, both in terms of for people maybe with hearing impairments. They're all subtitled, any videos and things like this. So we really have done a lot of work to ensure that our learning materials are accessible and also accessible across different devices. So you might be able to look at them on a phone, for example, or an iPad rather than using a desktop computer. We've also done a lot of work over several years to look at our assessments, and we've tried to ensure that they are useful and transferable, and they are very much related to our graduate attributes as well. So we have a lot of authentic assessments where we've moved away from things like exams or always writing essays to think about doing other types of assessments that will be useful for people working in the field of global mental health or indeed the field of mental health. So some assessments might be to design an information sheet, for example, to create a poster, to create a podcast, to write a blog. So lots of assessments that encourage development of transferable skills that are useful for the working environment. So in terms, oh, sorry about that there. So in terms of the key facts for the programme, so again, this is thinking about the MSc. The duration is between 2.5 and 6 years. So sometimes what we find is that students might take one semester on and then take a semester off and then work another semester, because we recognise that many of our students are working alongside their studies and at some points of the year might be quite busy. So we are flexible in terms of students being able to study. Usually if you are taking a course during one of the semesters, how it runs is that there is 5 weeks of teaching, a catch-up week, and then another 5 weeks of teaching. And then usually your assessments will be coming in probably around about week 6 and then maybe week 11, for example, in a kind of typical course. The semesters run in January, April and September, and we allow students to start in January, start in April or start in September, just when is most suitable for them. The cost is £15,000 for the MSc, although sometimes the fees do change, which equates to roughly £1,667 per 20 credits. Discounts are available for NHS funded students. And the study mode is 100% online. So we don't ask you to come to campus or anything like that. All the learning materials are online, and the vast majority of them are asynchronous. So you're able to engage with them at a time that's convenient to yourself. So I'm very happy to answer any questions. I can see in the Q&A there have been a few different questions there. So how many courses are expected to be taken during the programme? So we expect all students to take 6 20-credit courses during the programme, and then their dissertation as well, and that's for the full MSc. There is flexibility, so if you only want to do 3 courses, for example, there is a possibility to exit with a postgraduate certificate in global mental health, and there is flexibility as well that you can then come back, rescind your certificate, and go on and do the diploma, or then go on to do the full master's programme. But generally, if you're doing the full MSc, it's 6 top courses plus the dissertation. So how long is the master's programme? So generally, most students take around 3 years to complete the MSc. It is possible, technically, to do the MSc in a shorter time, but I don't think to date we've actually had anybody submit ahead of the 3 years. What would be the ideal number of hours that need to be invested on a weekly basis? So this is a common question that a lot of students ask, and it's one that's really quite difficult, I think, to answer. Because I suppose there are questions that would be, well, how many hours would I need to commit to, for example, complete the assessments and pass the coursework, or how many hours would I need to invest to be able to go through the course materials and develop a much more broad understanding of the field of global mental health. So it's really, really difficult to give you a particular number of hours. There is some guidance that for a 20-credit course, it's usually associated with, I think it's around about 200 notional hours of study time. So that gives you a kind of rough idea if we're thinking 200 notional hours for a 20-credit course, and say that's delivered over 10, 12 weeks, something like that. Would it be feasible for me to undertake this programme while working full time? So we do have a lot of students who work full time and undertake a part-time online distance learning master's programme. I think some of them are often surprised by the time commitment that they need for the master's programme, but I think we're quite good at ensuring that the assessment deadlines and the assessment questions, for example, are set and students are able to access them on day 1 of the block. So then they're able to put that in their diary and make sure that they're diarising time well in advance in order to prepare for their assessments and schedule time, weekly in their diaries to try and undertake the programme. So I think absolutely you can work full time and undertake an online distance learning master's programme. It's just about being kind of organised, as I'm sure everybody is, because there is lots of competing demands on people's time. So I always encourage people to, try and be organised, get things in their diary early, and ensure that they ring fence time just to make sure that they're able to undertake the requirements for the MSc. Will there be opportunities to network with other students and professionals, like conferences or in-person events? So yes, there are opportunities to network with other students. So I talked about the Microsoft Teams space. So we have a School of Health and Wellbeing wide postgraduate taught. So it's a bit of a mouthful. So it's SHW, PGT, ODL. So School of Health and Wellbeing postgraduate taught online distance learning channel, where all students who are studying any online programme within our school are added to the Teams channel, and we try and encourage students to maybe set up kind of small study groups, for example. We share any events that might be interesting that are happening within the school. So we're very lucky that we have lots of seminars happening within the school. Many of these are hybrids, so some of them will be happening in the school, and then there'll be a Zoom link to the hybrid kind of teaching event as well. So we tend to share these sorts of opportunities within our Teams channels so that students are able to join online, for example. Students are always welcome if they want to visit campus to come and meet with myself or any other members of the faculty. And they would be invited to come again in person to some of our learning events if they happen to be on campus, maybe visiting Glasgow for a different reason. And certainly I have met several of our online distance learning students when they've been in Glasgow, maybe for a different reason, and they've decided to come into the university and meet the faculty. But we don't expect people to come into Glasgow, which I think is key as well. Is there student funding scholarships available for international students in this programme? So again, there are, and I think we'll be able to put a link to the information about fees and funding and scholarships. So thank you for doing that. So I'm currently working as a counsellor. Would a master's in this programme be recommended for me? I have prospects to become a marriage and family therapist. So what I would say is that our Global Mental Health Masters is not a clinical course or anything like that. We don't train people to deliver therapy or anything like that. We do encourage students to develop lots of transferable skills that may be useful in their future career. And I definitely think having a master's degree is clearly going to be beneficial, and you will develop lots of transferable skills and critical appraisal skills and things like this that are really important potentially in your career moving forward. So we're not a clinical program, we're not clinical masters or anything like that, but we do, but there are lots of skills that can be developed by undertaking the master's program. Okay, so there's a couple more questions in the chat. So what does a typical week of study look like? For example, webinars, workshops, readings, essays, projects. So again, the learning materials are fairly, they're all kind of consistently organised. There's usually about 3 sections of learning materials within a typical week. And this means that you can, try and, they're not all in one kind of big kind of chunk. We sort of tried to chunk them up so that people can maybe set aside an hour or two and make significant progress through a particular week of study. What we've done is though we haven't organised live sessions for 4 p.m. on a Friday afternoon, for example, because we recognise that because our cohort of students are so global, they've got lots of different competing times, competing things with their time. It's very difficult for students to commit to a specific fixed time to attend webinars or workshops or things like this. So because of that, to increase flexibility, the learning materials are all asynchronous, and people, so if it suits somebody to be working, say early on a Saturday morning, for example, then people are able to do that because the learning materials are there. We have the Teams channels where people can post questions or comments, and that's through which the interaction tends to occur. We do sometimes have an online Zoom Q&A session near assessment kind of deadlines, but these are variably attended again because of various time commitments from our students. But we're all approachable within the programme team. If there are questions or anything that's not clear, we're always happy for people to reach out to us to let us know if we can help in any way, just to ensure that people feel supported when they're studying online. Because we recognise that sometimes can be a challenge, where with online study, because people aren't coming into campus, it can be a little bit more tricky to build up that sort of community, that community and sense of belonging within the online space. So we've done a bit of work to try and improve the online experience and build a sense of community within the online environment, but we're always keen to do more to just improve that. In terms of preparation that people might want to undertake before the course starts in September. So what I would say is because we are open to graduates from a wide variety of backgrounds, we don't necessarily expect a level of baseline knowledge, which I think is really good. But what we would say to, and what I tend to say to all students, is that there are a series of papers about global mental health that were published in the Lancet several years ago now, but these are really a useful kind of starting place. They're all open access, so they're free, publicly available, and it's a useful starting point, I think, just to start to read about global mental health. So this is the Lancet series in global mental health, and that would be, I think, a really good kind of starting point before the course starts in September. Other places for good kind of sources of reading, again, are from the WHO, from the World Health Organization. So they've got some really good um, reports and policy briefs about social determinants of health. So again, these things are really, really important. Being aware of sustainable development goals as well, I think are helpful. And again, these are all available free online from the WHO website. So these would be, I think, my kind of go-to starting points for some pre-course reading. Well, let me just check to see if there's any questions that maybe I haven't covered that are on this. So, accessing the reading list without visiting the library. So, we have ensured that all the materials that we reference and that we recommend you to read within the course are available through the online library. So, again, when you become an enrolled student within the university, you will have access to the online library, and you're able to access all the reading lists and all the papers and things like this that we would be linking to. In terms of topics that can be studied for the dissertation. So again, with regard to the dissertation, we have lots of potential supervisors within the School of Health and Wellbeing with lots of wide areas of research interest. And what we do is that we put a call out for projects, usually over the summer months, asking potential supervisors to put their kind of headline project within our project portal, and they can pick if they think the project would be suitable for global mental health student or the Masters in Public Health student. So the MPH is the other big programme within the School of Health and Wellbeing. And then what we do is during the course, we ask our students to fill in a questionnaire about what areas of interest that they have. They might be interested in doing their dissertation in. And we send a list of the potential projects to the students, and students are able to look at the list of projects and decide if any of those they think they would be interested in. And then there's a process of matching. Of course, some students are really keen to do their own project, and that's fine. We can accommodate that. So some students will decide that they wish to do their own project, and we can assign a supervisor who can support them with that. So one of my online distance learning students who graduated very recently was interested in climate change and the sort of mental health effects of being a first responder to a climate emergency. So I supervised her project where she interviewed first responders who'd been involved in responding to it was wildfires that had occurred probably due to climate change. And that was a really nice project. It was her idea, it was very much led by her, and I was able to supervise her and support her doing that project, and she did really well. So the question here about is an online degree as good as a on-campus degree? So we have an on-campus version of our online distance learning Global Mental Health Masters degree, and we've done a lot of work to ensure that the learning materials and the assessments are very, I'd like to say, harmonised between the on-campus programme and the online distance learning programme. So people will be doing the same assessments as our on-campus students. So we're very clear that an online degree is as good and is the same as an on-campus degree within the University of Glasgow. And there's no difference in your transcript, for example, or the award that you're being given at the end of your degree compared to our on-campus students. And indeed, the graduation event is the same. So the online distance learning students are able to attend in-person graduation, usually in December time. And again, last year we had a number of our on-campus students graduating, and we had our highest ever number of online distance learning students who came along, and they all graduated together, and it was a lovely event. I think I've probably already covered about networking on the online programme. So we also have a staff student liaison committee and a staff student rep. So our current ODL staff student rep has, I think, just submitted her dissertation. So we will be looking for a new one, and we always ensure that we have a staff student rep for our online students. And I meet the staff student rep regularly with Andy, who is our program administrator. Unfortunately, she wasn't able to join us this afternoon, but we have a good relationship with our staff student rep, and we're able to get feedback about any good things or any maybe not so good things about the online distance learning program, and we always ensure that we act on the feedback where appropriate. So we do have a good communication with our students and our staff student rep within the program. Okay, so there's another question in the chat again about when is the exam period? Is it usual to have exams, or do most classes have essays projects to pass? So this is a good question. So generally, most of our courses have assessments rather than exams. So I can't think of any example of a course within our school that has online exams, for example. We have a range of assessments, a range of courseworks that all are submitted to Moodle rather than an online exam, for example. So again, the dates tend to be given right at the start of the course, so you can get them into your diary early and just plan your study and your time around them. So exams are not a feature of our online distance learning master's programme. I wonder if there's any more questions. I can't see anything else in the chat. Hopefully I've answered anything, any questions anybody had. Is there any more questions, or are we happy to finish up there? And just to thank people for joining this online webinar. If there are any questions or anything that's not clear about the admissions process, then please get in touch with Online Degrees Admissions at Glasgow .ac.uk, and there is some information here just about I think that's our taster course that you can have a look at as well. So apologies, I should have mentioned that we have a short taster course that you can also have a look at. And that gives you an idea about what our learning materials look like, for example, just if you are studying for the first time online. So thank you very much for joining us, and I hope to see you all on the Team Space in September. Thank you very much.